Obamacare officials confirming there is still no system yet, as we told you last night, for moving the money from the Obamacare customers to the insurance companies. These subsidies that the government promised the insurance companies it would give them in order to give, coverage to these millions of Americans. Great. It's a wonderful promise. Unfortunately, there was no mechanism to actually cut the check. The problematic healthcare.gov website, it's not built yet. That part of it that provides for payment, not built yet. And for days, many journalists have been demanding answers of this administration, wanting to know how you're touting this improved healthcare.gov. How does the system work without a payment mechanism? There's no cash register. What would make the insurance companies actually provide coverage when they haven't been paid? We reported this to you last night. Without a way to get payment to those companies, how are people actually going to get coverage? So now tonight at 8 p.m., get a report with an answer from Reuters News. The administration is going to let the insurance companies estimate what they should get. And then the feds are going to cut them a big check and figure out later what the real amounts are supposed to be. That's your money. That is your money. They're going to do a back of the envelope. The insurance company is going to say, I think it's this. And then the feds are going to pay it. Think about that for a moment. Think about that. We're talking about 1/6 of the U.S. economy, and this is the system that they've now settled on, released privately late in the evening. And then consider what the president said just this afternoon.
The bottom line is this law is working and will work into the future.
Ovik Roy is a senior fellow at the Manhattan Institute, National Review columnist, and author of How Medicaid Fails the Poor. This is unbelievable. I mean, this is from the Reuters report an hour ago. Health plans will estimate how much they're owed, and then they'll submit that estimate to the government. Once the system is built, the government and insurers can reconcile the payments made with the plan data to true up the payments. Oh, joy. So it's basically an honor system, if I'm reading this correctly.
Well, the basic thing to understand is it's not a bailout of the insurers, it's a bailout of the president. Because 2 weeks ago, we heard from one of the top IT officials in the administration that the systems to pay the insurers hadn't even been built yet.
Right.
This was 2 weeks ago.
30 to 40% of healthcare.gov, he said, has not yet been built. And we talked at the time about, well, okay, what part exactly is that? And they revealed it was the payment mechanism.
Yeah.
So now for weeks, people have been saying, well, how are the insurers going to get paid? And this is the solution, Ovik?
This is the solution.
We're going to trust the insurance companies to say, I think you owe me X million in subsidies for the following people who have submitted for coverage. Is that basically how it's going to work now?
Basically, because what's the alternative? The alternative is if the insurers don't get paid that way, then the insurers will hemorrhage money trying to cover all these people, and they'll withdraw from the market.
They're not going to do it.
So the Obama administration is saying, well, the only way we can keep the insurers participating in this market is to pay them in advance and trust them.
If the person successfully enrolled through healthcare.gov and there had been a payment mechanism portion of the website, that portion would have had what on there? People would have had to enter financial data. I mean, is this the portion of the website that calculates how much of a subsidy they're going to get and then tells the feds, okay, cut that amount of a check to Aetna?
It's the simple system of when the individual signs up, and that he signs up for a particular plan, he has to actually pay the insurer for whatever the subsidies don't cover. And the insurer can't get paid for that because that system hasn't been built. So the insurer, you aren't officially enrolled if you haven't paid the insurer. Technically, enrollment doesn't happen unless the insurer has gotten a check from you. And so you may go to the doctor, think that you've signed up on healthcare.gov. The doctor says, you're not insured. I don't have an insurance policy for you. And that's when the people say, well, I've just consumed all these services.
But now let me ask you, because I think you might be conflating two issues. You're the expert, not me. But there are two issues, at least tonight, with this system. Number one is reports today are everywhere that up to 30% of the people who have enrolled on healthcare.gov only think they've enrolled. And that, in fact, the enrollment has failed, and that when they go to their doctors on January 1st trying to get coverage, they're going to find out the hard way that their attempted enrollment failed and they don't actually have coverage. But problem number two is 30 to 40% of their website is not yet built, and it's the portion that accepts payment. And this announcement tonight relates to issue number 2. They're trying to get a way to improve the payment situation. And according to this Reuters report, they are meaning to cover the subsidies and premiums that the insurance companies are waiting for.
So there's, as you say, there's 2 issues. In the private sector, in the private health insurance market, the way it works is you're not officially enrolled in a health plan until you've sent a check to the insurer has received payment, then you are enrolled. So what the administration is calling enrollment isn't really enrollment. They're just saying you've been signed up correctly for the plan. But you can be signed up correctly for a plan, which is the 2/3 you're talking about,
right,
and still not have paid the check to actually be officially enrolled.
Right.
So that's the problem. The payment is what creates the enrollment. Signing up for a plan but not paying does not count as enrollment.
And so the solution tonight, because you cannot pay right now, is they're just going to, the feds, Uncle Sam and the insurance companies are going to sit down together. The insurance companies are going to say, trust me, this is how much you need to give me. And for this amount, I will cover the following people. And then later they're going to true it up, Ovek. Do we have reason to believe, I mean, with all due respect to the health insurance companies, have you ever dealt with a health insurance company? I mean, do we have reason to believe that we can just trust their word and that later, if we, the taxpayers, paid them too much, they're going to give us a big refund?
In this case, we have more reason to trust the insurers than the Obama administration, because even if the insurers are dishonest, everyone's going to get mad at them. And they're already so politically under the gun that they're just trying to keep their heads down and not get shot.
But do you have any idea of the waste, fraud, and abuse that's in this system already? And
Absolutely.
Now, instead of having an actual system that will calculate the payment and make sure that the T's are crossed and the I's are dotted, we're going basically on an honor system where the insurers are going to tell them, this is how much of the American taxpayers' money I want, and we're going to start cutting checks.
The real area where the waste, fraud, and abuse is an issue is in the size of the subsidies, because that's where the true honor system is. There was a report issued today by the auditor of the IRS that says that the IRS doesn't have the systems to check what your income is, to see what subsidies you're eligible for, and that's going to incentivize a lot of Americans to game the system and say, you know what, I actually didn't make that much money this year, therefore give me a bigger subsidy, a bigger check. That's where the fraud is, and that's where the real problem is.
My head is swimming with the amount of issues that we've just ticked off just in this one segment. Ovik, thank you for being here. Before this news broke tonight, President Obama attempted to hit the reset button on his health care law. We just played you a sample of it there. The law works. Really? How does it work exactly if there's no mechanism for payment for coverage?
My main message today is we're not going back. You got good ideas? Bring them to me. Let's go. But we're not repealing it as long as I'm president. I want everybody to be clear about that.
Chris Direwalt is our Fox News digital politics editor and host of Power Play on FoxNews.com Live. In the 30s now, yeah. Chris.
Well, and we're not repealing it as long as he's president, ellipsis, but after that, who knows? It seemed to sort of invite the question. The president down in popularity, the law down in popularity. Every day brings a new problem, a new missed promise, a new disaster. Fresh horrors await. And the president says, I know, but we're going to drag forward into this thing. We're going to put it in place, whatever we have to do. And it's going to be the law of the land at least until 2017. That sounds more like, it sounded to me more like a funeral for the hope and change. He was even kind of dressed like an undertaker. It was not much of a campaign rally.
You know, you can see the picture of Barack Obama and Joe Biden standing together if Joe Biden becomes the Democratic nominee, and the president saying, this is a big bleeping deal. Right, you know, the same words that Joe Biden said to him, like, good luck with this. But
good luck with this.
So the president today launched a reset. He tried to hit the reset button on his failed rollout of Obamacare. At the same time, we get these reports that not only now is there not a payment mechanism, and tonight, we knew there was no payment mechanism, but tonight we get the word that, okay, their big fix, which they refuse to reveal for days and weeks on end, the big fix is they're just going to start cutting checks. They're just going to start doing it without that system being set up, and they'll true it up later. So we're going to trust the administration. We're going to trust the health insurance companies not to screw us. And seriously, I mean, it's 9/10. I can say that. So secondly,
yes.
Secondly, we find out that up to 30%, according to news reports today, up to 30% of the people who did go through healthcare.gov, who sat on that website, Chris, for days in some cases, who made it through and signed up, will find out in January when they go to have their operation that they have no health insurance. How is some reset button going to solve that problem?
Well, it ain't. and I think right now the plan is they're going to gas up some B-52s and just start dropping money over the state of Connecticut on the insurance companies and hope that enough gets down on the ground so that all these millions of Americans who had their policies canceled can actually get insurance. Just please, God, give them insurance is the plea from the administration. We'll give you whatever. The news that broke yesterday evening was the fact that they've laid the regulatory groundwork for the eventual bailout. The law provides a provision for a bailout loan to go to the insurance industry. New York Times found, slipped into the federal, not slipped, but entered into the Federal Register there that said this is how we're going to provide the future bailout to the insurance companies that we have regulated to the brink of oblivion.
Because wait, let's just go through how that happened. The president made a promise that was not true about if you like your plan, you can keep it. Then for political reasons, because the ceiling was crashing down upon him and other Democrats, he offered a fix. The fix was, I'll try to make my promise come true if the insurance companies will go along with me. Well, the insurance companies say, we're not going along. We're not going to let those people keep their plans. The whole system depends on the young, healthy people getting kicked off of their plans and going into this new higher cost risk pool, and we're going to be the beneficiaries of that. That's the only way we agreed to insure the old sick people for these costs. And now that the healthcare.gov website doesn't work and the president is saying you can stay on your old plan, you don't have to go pay the new money with it, it's starting to implode. And the solution is, let's just give them more taxpayer money. We'll bail out the insurance companies, or however you want to phrase it. We're going to give them money to make this worth their while. And it turns out that, too, was baked into the law, which we had to pass before we knew it was in it.
You know it's right. And the carpet bombing Connecticut with sacks of cash is just the beginning, because as Ovik said before, the reality of this is with all of these navigators who are incented to get as many people signed up for the law and as much subsidy as possible, can you imagine on the other side of this how much this is all going to cost? The numbers become rather staggering.
Dan Schuyler is director of Levitt Partners and former director of technology for the Utah Health Insurance Exchange. Dan, good of you to be here. So we are talking now about the subsidies that the insurance companies are going to pay. I'm sorry. We're talking now about the subsidies that the federal government is going to pay the insurance companies, right?
That's correct.
Okay. And so now the new system is going to be insurance companies say, well, I've had X number of people enroll with me. I'm Aetna, and I estimate you, Uncle Sam, owe me $7 million. And then Kathleen Sebelius is going to write out a check and say, here's the $7 million. Please do insure those people. And then they're going to chat later about whether $7 million was too much or too little, and they're going to true it up. Is that essentially what they've announced tonight?
Yes, it's an interesting workaround for sure.
Yes, there are reports out today that perhaps as high as 30% of the folks who have enrolled or think they have on healthcare.gov, this is a separate problem, have not in fact enrolled, that there have been these problems with these forms, and so that they may be sitting at home right now saying, I'm good, I got through healthcare.gov and I got my insurance, thank goodness. And then they're going to go for some procedure in January and find out the hard way, they're not insured at all.
Well, this is the latest manifestation of the fact that they went up with a website and a system that wasn't finished. And so they're trying to find a way to work around that. It seems to me this might resolve the problem of the insurance companies not being paid the correct amount of subsidy money. I don't think it solves the problem, though, that you were talking about earlier, Megan, or just now talking about, actually, about people thinking they were signed up, but because of the problems with the back end of this thing, improper data or the wrong data going to the insurance companies, and these people aren't signed up.
It's a separate issue.
Well, it is, and you know, you think about it. You think about the reaction we've had to people who, you know, found out that they had lost their insurance. It was pretty strong. Well, think about the reaction to that problem. It was likely to be equally as strong. We don't know how many people it would affect, but you know that one estimate today was a third. That is a big number. So this illustrates one of the political headaches here, Megan, that makes this thing such a nightmare, which is that a lot of the problems are still out there waiting to happen. Looming.
But the administration, I mean, the president came out today and said the law is working. It's not going to be repealed while he is president. And through OFA, he's come out with this new sort of marketing campaign that they're encouraging people to, what is it, shop, enroll, buy. And we've got the full screen. We'll put it up in a minute. But the problem is here: apply, shop, buy. Well, if you try to apply, we're still getting error messages in many cases. You shop, I guess. In order to comparative shop, you have to enter all your personal information, and that has raised some security issues. Buy is not really possible. Let's be honest, Britt. It's not possible.
Right, and I think if you're able to window shop, and I think in some state exchanges or the federal exchange in certain states, you are able to do that. That thing on the screen there is an example. That's what our correspondent Peter Ducey got a dose of that when he was trying to see whether it was working as advertised. Yeah, trying to shop. But this, Megan, I think illustrates the political problem with this. The president is trying to go to the campaign style effort to sell this. This problem, I think, is not really susceptible to that kind of a solution. Campaigns and the issues that are argued in campaigns tend to be about things that people understand as a matter of principle or in the abstract. The number of troops in Afghanistan, the progress of the war, these things can be argued over. We're talking here about an issue that affects nearly everybody in one way or another, or somebody they know, and this is hitting people directly, not just through the media, although there's been plenty of that, but directly. And when you've got 5 million people who have lost their insurance so far, with millions more to come, not to mention the number of people who have tried unsuccessfully to use this clunky website. You're talking about people themselves feeling this directly, and that is the kind of problem that I don't think it's easy to campaign your way out of.
But Britt, they maintain that if they can just get this website working, people are going to get on there, they're going to see great deals, they're going to start enrolling, they're going to avoid the death spiral of only having the older and the sicker people enrolled on these exchanges. The young people will flock to it. Then the system works. That turns things around, including politically, for the Democrats who supported this law.
Well, the problem with that is, look, it is certainly true that some people, and perhaps a great many people, will eventually be able to log on to this website and will be able to acquire an insurance policy either with the help of a subsidy or because it's sold at a reasonable rate that they're satisfied with, and they get on with their lives. Those are the people who the administration is counting on. But remember this about politics. It is almost always the case that negative emotions, that people who are dissatisfied and angry are motivated to get out and be politically active, to vote, to organize, and so on. People who are satisfied and content, they have other issues on their mind as well as that. And it will help that they're satisfied and content with their health care insurance. But they're not going to be as profoundly motivated, in my judgment, as the people who are angry about this, and we know there are going to be millions of them.